He is a urologist, and he's going to be talking more clinical stuff in the next few months on our podcast. So before I forget, I just wanted to say, if you like that intro song, that is done by my good friend Lee Pence. He is a musician, guitar player, and he played guitars on that track. And if you need any kind of music made, that's exactly what he does. He has his own recording studio, and check him out, leepence.net, or Google him. He's got a YouTube site also. So check him out. He does really, really good work. So Dr. Wallen, welcome back to our show. We're going to be talking about funding of healthcare in a non-traditional method. I know we've been told that healthcare is super expensive and you have to have this traditional health insurance because it saves us so much money, and we don't want to have cancer or have a heart attack and not have health insurance. So you're going to tell us some non-traditional ways to fund healthcare, correct?
Absolutely.
All right.
Good to see you guys.
Yes. Well, welcome to our show. And I'll just let you start by, how did you get into this role of funding healthcare in a different way?
Well, I mean, I think, the reality is, we're all patients, right? At the end of the day, every single human being on the planet is a potential patient at some point in time. I don't come from a lot of money. I leveraged, $500,000 in debt to get through my medical training and such. And what I kind of realized and with my business training and kind of ability to see the greater picture type situation, I realized kind of what a scam was happening for individuals and families as far as traditional health insurance, and kind of the deeper you dive into it. And for me, I think just like most of the other healers that are out there, the other physicians and everybody else on the healthcare team, on the clinical team, we got into this to help people, right? And so when you get there and then you realize you either can't help people because there's some corporation telling you got to do something else because it's cheaper, or whatever other example you want to throw out there, that makes it very painful. And that's where you kind of hear maybe this term moral injury, where you basically are trying to do your best as the clinician, but are limited by either monetary or regulation constraints by the systems. And that's where I think from that standpoint, that pain for me really kind of just made me realize that, number one, people don't have a great financial education in our country, but number two, when it comes to healthcare or medical care, that's significantly even further down on the list of strengths for the individual families. So that pain is what really kind of brought me through this passion to be a even more of a patient advocate and take the leap to try to educate as many people as I can with the tools that I know, kind of to some extent from the backstage viewpoint of things, having been a patient, but also, kind of seeing how it works as a clinician and trying to help people save thousands of dollars if they possibly can and get better care. Because we all know it's out there. And I'm sure we'll talk about it, but, certainly, the inflated costs of the system are largely created by so many middlemen that are there, whether it's health insurance or GPOs or PBMs, which you don't even really need to know what those terms mean, but there's a significant amount of people pulling money from the system. And it's basically, to some extent, kind of robbing our individual paychecks if you're a W-2 employee as well. So, from that standpoint, wage growth, I think since the Affordable Care Act, wage growth has been about just under 10%, right? When you compare it to inflation. When you look at, premiums and deductibles have risen 111%. Premiums are up 61% for families. And then you look at United Healthcare stock prices over that same time, and it's up 1,600%. And you kind of start to realize what the scam that's going on. And just, really, that's crazy. And especially when you consider almost 70%, 69% of individual families have less than $1,000 in their bank account. Whereas, these high deductible health plans, you have to pay more and more in deductible before you actually get coverage. And most people can't even afford those deductibles based on the fact that they only have, less than $1,000 in their bank account. So, again, it's trying to do whatever we can to serve the people that we're trying to serve, which for me, I got into medicine to serve all the people I possibly could that needed help especially from a urologic standpoint, since I'm a urologic specialist. But in the reality, if I can't even help them through the financial part of it, then that's difficult for them to chew on and access care, which, again, a lot of people love the Affordable Care Act, but I think there's a lot of problems with it. And one of them is that it mandated coverage. It didn't necessarily mandate care, which is really what you need, right? And so, from that standpoint, trying to actually get people access and actual care, especially when we can deliver it in a low cost manner to help them financially and protect that portion of it, that's where the holy grail is for me. So that's where taking all the pain that I had from, kind of realizing how much of a scam the system is, and really kind of seeing how I can benefit people. And I think that's where, patients really need to be educated and empowered to be a consumer again of medical care, because otherwise they're just getting taken advantage of.
Yeah, for sure. So Janet, you have any comments on that? That was a lot to
It
take
was a
in.
lot to unpack.
Thank you, Dr. Wallen.
It was. But, this morning when Shawn and I were talking about you being a guest, Jared or Dr. Wallen, on our show, the oxymoron of this is that really at least 30 to 50 years ago, we weren't in this position.
Right.
Doctors and surgeons and physicians were all more in a control of our healthcare system. So do you perceive that as being one of the biggest problems? I mean, that's kind of how I identify it, but what is that really what's kind of driven us into the corner of not being able to provide that care?
Yeah, absolutely. I mean, the fact that again, as a W-2 employee, I'm beholden to whoever is the CEO or what have you. Back in the 80s and prior to that, physicians were their own independent small businesses, right? And so then I'm the ultimate decision maker, not some business type or what have you, or some ex-clinician who's now a business type. And over that time period, there's been multiple different pieces of legislation, and the Citizen Health Group with John Chamberlain and Brendan Hodge, they've made a nice graph where basically they document the legislation and they document the growth of administrators, which has been like 3,500% or no, excuse me, 4,500% growth in administrators since the 80s. So managers, middle managers, all these different layers of management for this corporate medicine conglomerate, right? Whereas physician growth is like a stagnant line at the bottom. And you see that, the cost has kind of mirrored the growth of administrators at 3,500% since then. And so, not only does that drive up cost, and I would personally argue at the end of the day, think about it, if you took away all those physicians, all 1 million of us in the country, or 1 million plus, I guess, but if you took us all away, none of those middle managers or management could actually deliver you any possible value as a consumer of medical care. And so, from that standpoint, they're telling me what to do when they don't even know what the best thing for the patient is, based on mostly financial decisions, right? But they're also, essentially to some extent kind of controlling, what I can and can't do, or how I can and can't help patients. Not only that, but from a business standpoint, if I'm an independent physician practice, small business, I can say, hey, listen, I'm going to give you a discount, or I'm going to, comp your care. Whereas as a W-2 employee, you just can't do that. And so, right. That's where, I mean, even some of these let me make sure I get it right. These tax exempt nonprofit hospitals, right?
Right.
Even some of them, I mean, they own collection companies. And right. So it's crazy. I mean, look, Marty McCary in his book, The Price We Pay, talked about how in the state of Virginia in 2017 alone, there was only 37% of the hospitals that actually sued patients. But of those, they filed 20,000 lawsuits in the year 2017 alone. And so, from that standpoint, I'm not saying that we can comp everything. It shouldn't be free. It can't be free, because at the end of the day, somebody is paying for it, whether that's out of tax dollars or what have you. We all have to, we talk about skin in the game and kind of taking accountability and responsibility for your health to some extent. But yeah, I mean, the corporatization of medical care has certainly not only disempowered patients, not only disempowered their clinicians, their healers, but it's driven costs through the roof.
Well, and just because somebody is nonprofit doesn't mean that they're out there for the good of the patient. And like you say, they are suing patients. And it's like they shouldn't maybe write everything off. I get that. But when the price is jacked up tenfold what it really should be, and they're sending patients to collection and suing them over their bill, there should be some kind of middle ground for sure, especially if they're doing this in the name of charity, which, as John Chamberlain will tell you, who is a former hospital administration, it has nothing to do with charity. It's all about bottom line to hospitals, profit, nonprofit, public, private. They're pretty much all the same.
Well, and those nonprofit hospitals are supposed to be delivering more charity care, right? But those tax exempt hospitals, but they're actually delivering less than private and public hospitals. And on top of that, again, they're sending people collections. I would argue actually even more than 10x, 23x is, I think, what Marty McCary mentioned in his book, The Price We Pay. And I mean, you think about that. If you have to pay 10% of $1,000, that's pretty manageable, right? But if you're talking about the same service at $100,000, paying 10% of that, I mean, again, for most people, that's not even in their realm of possibility. Right. And so that's where the markup discount game that a lot of retailers play is being played by insurances and hospitals together. They play this game together because they benefit. And not only that, remember, they're also hiding their prices, right? Because, I mean, yeah, there's been an executive order by Trump, which was reinforced by Biden. But ultimately, I think only like 14% of the people that are of the hospitals that have been kind of reviewed in certain subsets of I think it was of 1,000 hospitals by a patient right advocate. I mean, only 14% are actually in compliance. And that's because they can make a heck of a lot more money by hiding their prices and jacking up the prices. And I mean, I think just a specific example, the Medicare allowable payment for a joint replacement is $13,000. There's 1 in 6 hospitals in the United States that are charging $90,000 plus. Oh. And there's some that are charging $115,000 for it. And so again, and the problem also is, again, there's and medicine right now is anything but a free market, right? And so because of that, because of the regulations that are out there, the limiting of competition, these big conglomerates, the big hospital systems, the big health insurance companies are able to kind of just take over the market and do what they want. Whereas if it was a free market and we could compete, I mean, certainly everybody would probably choose, the lower cost if they understood what was going on, right?
For sure. So Jan, do you have any questions on those?
Well, I just have a comment to you as a doctor. How does it make you feel when you know that there is a specific treatment that's going to save the patient money and you're going to get to the root of the problem, but you have to go through all these other steps that cost more and you end up charging the client more, when in the beginning you could have practiced the art that you were practicing and just take care of the problem immediately? I mean, how does that put you as a practicing, other than just frustrated? I mean, what tell us how that feels to you and what that does to your colleagues.
Yeah, I mean, I think that's the definition of moral injury, right? If you really understand it, it's truly us trying to do the best we possibly can for the patient, but being significantly limited by the system. And that's why, I mean, physicians have double the suicide rate as the normal population. That's why there's physicians that are burning out and getting out of medicine altogether, because not only the financial part of it, because quite honestly, I would argue with you, a lot of the physicians, my colleagues, don't know the financial part of it. They haven't taken the steps to understand what the costs are for each thing, like a lot of people who advocate for free markets do. But I mean, the reality is that, there's so many, I would say when I worked for a corporate hospital, I was handcuffed, I was gagged, and I was, to some extent kind of abused as far as trying to actually be able to help patients, because it's something that you take internally, and maybe nobody ever sees it on the outside, but it does, each chip, right? Each time you chip away at the rock, the more you chip away, the less healers have to give, right? And you have to be able to have good health and have good mental state to be able to give to others in the first place. And so if you're talking about a situation where you're kind of captive by the system as the healer, as the clinician, it makes it so difficult to actually truly get out there and do the right thing for the patient.
So we've identified the problems or some of the problems. And, you know, I mean, we hear people like yourself and many other physicians or people in healthcare complain about it. But you went a step further, Dr. Wallen, and you have some solutions. So what are those solutions?
Right. So, I mean, I went ahead and created Self-Directed Medical. Mainly, it's an education program for patients because, again, that financial knowledge for medical care is not there. And I think the reality is that I got to stop saying that, but whatever. It really, truly is a problem of the corporate medical system, right? If you can get outside of that and still protect yourself as a patient, then you can achieve significantly lower prices and, you know, get the highest quality possible care that's out there. And so from that standpoint, you know, basically we kind of talk about 5 main pillars. One is, you know, your day-to-day care, which, you know, there's direct primary care out there that which can offer a significant cost savings for folks. And it's as cheap as $1,000 a year for 24/7 access and access to, you know, some extra things on top of that, wholesale meds, wholesale labs, what have you, that can save even for Medicare patients. I talked to a DPC down in Fort Myers the other day, Dr. Rebecca Bernard, who I think has been on your show as well.
Mm-hmm.
And she was saying that even for Medicare patients, she can actually save them money if they join her direct primary care practice. Just, you know, for instance, if they have, you know, 4 or 5 different medications that they're on, she can actually save them enough money that they pay for their membership just by, you know, getting them access to wholesale medications. And so from that standpoint, that's huge, you know, because again, Medicare, a lot of Medicare patients are limited in their ability to, you know, kind of generate extra revenue or what have you. And actually, there's some AARP data that shows that Medicare patients, the two of you together, you and Janet, when you get into Medicare years between, say, 65 and 85, or maybe even 95 plus, however long you live, between that 20 and 30 years plus, most people will probably spend $230,000 to $340,000 out of pocket. And most people don't even have that saved for retirement alone, let alone for medical care specifically. And so if you can, you know, kind of do that, or, you know, even just, I know another friend of mine who has rheumatoid arthritis, and he actually saves more money every month on his rheumatoid arthritis medication through his direct primary care than he does than what he pays for the membership. And that's just for 1 or 2 medications, I think, that he's on. And so that's huge. Plus also just think about it in just one instance, right? If you can call your direct primary care, if you got a cut in your hand, you can call them and you can avoid going to the emergency room because you have access. Again, not talking about coverage, we're talking about access and care, which is the most important piece. If you can call them, text them, telehealth anytime, or even, you know, what have you, and avoid going to the emergency room and avoid getting that $10,000 or $15,000 bill for sutures or what have you, I mean, that's huge. So, and that's just one example, one time. So, you know, that's a huge pillar for day-to-day stuff. Beyond that, for catastrophic coverage, so we have to have day-to-day coverage. We have to have catastrophic coverage for those big costs like surgery, like you know, admissions to the hospital, like emergency room visits, what have you. We also have to specifically talk about the 4 main things that patients typically get robbed on and find wholesale prices for them, which I'll mention in a bit. But beyond that, there's also financial accelerators like HSAs, like HMAs that can be helpful for that out-of-pocket costs. And then finally, it's really just trying to be as healthy as you possibly can to stay the heck out of the system in the first place, which is the 5th pillar. But so we talked about direct primary care, those catastrophic costs. I mean, sharing programs are great for that for families and individuals and even small businesses. There's also level funded plans, which you know, can be helpful for kind of a little bit bigger businesses between 15 and 50 employees or so. And then beyond that, a lot of businesses will actually self-direct their care and basically have a self-funded plan where they take on the risk rather than paying somebody else to. But, you know, again, if you can couple some of these things, especially direct primary care and sharing, I mean, sharing is a great opportunity to save about 50% of your health insurance bill and potentially even reduce your deductible to, you know, $1,000 or so, which, you know, again, if you can do that and save money, why not? Right? I mean, I think there's 1 million people across the country in sharing programs right now. And I would argue that, you know, we would be a lot better off if there was, you know, 50 million or 100 million people across the country, or even, $300 million, all of us, if we could all get into a sharing program rather than these kind of mandated programs. I mean, even what Medicare Advantage and a lot of the Affordable Care Act programs, they don't even include the best doctors. They don't include the best cardiothoracic or the best cardiologists. They don't include the best oncology folks across the country. And if you have a real bad problem like cancer or heart disease, which is also common, I mean, I think I actually just read a quote the other day that I think every 36 seconds somebody dies from cardiovascular disease in our country.
Wow.
And I think across the world, it's like 1 in 5 people die from cardiovascular disease, right? So that's a huge problem. But if you can actually get to the centers that are the most experts in it, or at least if you can find somebody close to you or what have you that will work with you directly and will kind of jives with you rather than being mandated into these tiny narrow networks that insurance companies make you go to so that they can make more profits. That's huge, right? I mean, ultimately you have to have a relation. It goes back to kind of what Janet mentioned about kind of that 1980s earlier medicine, that relationship-based medicine where your doctor actually knew you and knew kind of more about your life and about your health and had more time to spend with you. And that's what one of the biggest things that corporate medicine has kind of miscombobulated, because basically it's a numbers game in corporate medicine, right? So you have to get on that as a clinician to make profit. You kind of have to get on the hamster wheel and just try to produce as much volume as you possibly can for the corporation, and that's not in the best interest of the patient, because you're getting a 10 or 15 minute max visit where you should probably have 30 minutes to an hour to truly kind of understand and go through whatever you can possibly do to prevent having problems, right? So that's kind of that catastrophic stuff. Again, sharings are great. I mean, Zion's great, Sedera's great. There's a couple other ones out there that are good too, but level funded plans and self-funded plans are more for businesses, which certainly, to some extent, when you think about this, a lot of the folks that we try to work with are entrepreneurs or small businesses, because they actually have the power of choice, right? Because unless you're going to take the information that we give you and you're going to go to your employer and say, hey, you need to look at this stuff and try to advocate for yourself with your employer. A lot of your employers, especially the bigger ones, they lock you into whatever choices they offer you, right? So you don't have that power of choice as an employee a lot of times, which is unfortunate. But I think that hopefully we can change that with time by working on these employers. Again, then beyond that, I mean, I think direct primary care, again, going back to the first pillar, actually helps with the third pillar, which is, I mean, the four main things that people get kind of robbed on for price is images, labs, medicines, and transport. And at least 3 of those, you can probably get wholesale prices with your direct primary care. So medicines, labs, and images. And again, I think the biggest warning sign I could tell anybody is never, ever go to a hospital for images or labs or medicines if you don't have to. If you're not there for emergency care or you're not admitted, absolutely find somewhere else. Find an independent radiology place or an independent lab or an independent pharmacy and go get that stuff from them and not go to the hospital, because again, they inflate the prices so much. I mean, your standard CT scan, $350, $500 across the country. I've seen horror stories of $10,000 or $13,000 for these same images at hospitals. And so, they jack up the prices so much, and that's, again, huge problem for patients. So, never ever do it if you don't have to. If you're not already in the emergency room or you're not admitted, it's not a reason to do that. Again, the fourth pillar is really kind of HSAs, HMAs, right? So HSAs, health savings account, a lot of people know about them, although there's not a lot of folks that are actually using them across the country. I think it's like maybe somewhere around 40 or 50 million now, which is still pretty low. But they quite honestly, I think an HSA, the good thing about them is it's tax deductible money, right? So it goes in pre-tax. So you actually can kind of save some of your money that way. But to a large degree, it's dollar for dollar when you're spending it. Although if you spend it for medical care, there's no taxes that are applied, but it's dollar for dollar coming out as it goes in. So quite honestly, I mean, it would be, there's a great opportunity with an HSA to actually save money for retirement. Families can file away about $7,600. I think individuals are like $3,650 or something like that as of 2022. And if you add that up over the years, the beauty of the HSA is it's triple tax free, right? So it's tax free going in. You can actually invest it in the stock market or other options, and you can actually grow that money through the years. And then it's tax free coming out as long as you spend it for medical care, or alternatively, once you hit 65, you can spend it on anything, and you can actually use it as a retirement account. The only caveat to that is you do get taxed based on your income if you spend it for other things other than medical care. But even so, I mean, even if you're able to save up $100,000 in an HSA over the course of your younger years, and you have that available for medical care as you're older, and we already talked about $230,000 to $340,000 for the average couple in their Medicare years for out-of-pocket expenses, right? So that's a great way to do that. I think personally, I think the HMA is a better out-of-pocket accelerator. It's basically a prepaid Visa card, which you prepay the contributions monthly. Over the course of about 3 years, the value of it actually doubles. And so, you pay in, shy of, $20,000, and you end up with $40,000, which you can use for yourself, your spouse, and any dependents under 26 for all your out-of-pocket costs. And so then you're actually paying half off for anything that you're paying out of pocket at that point. And then you can kind of recharge it up throughout the years if you use it. So that's a nice way to kind of really kind of take advantage of some of the financial accelerators that are out there, and truly kind of save yourself some money as an individual or a family. So
let's clear this up on HMA. How does it double over 3 years?
So it's actually just an account that's been created by actuaries from Millman. So it's not invested, it's not anything like that, but it's basically the value of the account is the utilization and such like that is such that the actuaries have determined that they can allow your value of your account to double over 3 years. And so it's not an investment. It's basically just kind of a financial accelerator tool that can be used. The only caveat to that is that there is no cash value to the account once you put the money in, right?
Okay.
So the money is sunken as a cost once you put it in, but the value of it essentially doubles, and you can use it for anything that you would use, for your out-of-pocket costs. You get a little Visa card, prepaid Visa card from them, and basically you can use it from your chiropractor, for your labs, for anything that you would otherwise, pay out of pocket for, co-pays and that type of thing, for your medical care.
Interesting. Okay. I wasn't privy to that information. That's great, Dr. Wallen. So there's one more. There's a fifth thing, pillar that you like to talk about. What is that?
Yeah. So the fifth pillar is really just avoiding the system at all costs, right? I mean, the best way, health, I would argue that health and time are probably our most valuable assets. I mean, money is just a tool, right? And from that standpoint, health and time are our most valuable assets in our short time here on Earth. And from that standpoint, trying to do whatever you can to be heart healthy and get your movement in every day, 30 minutes of cardiovascular activity at least 5 days a week or more, and even if that's just a walk for 30 minutes, I mean, that's still better than being sedentary, right? And actually right now I'm standing as we're having this conversation, right? And so there is a decent, we especially in the corporate world, in the business world, we spend a lot of our time sitting.
Yes.
And there is a significant amount of data that does show, certain risks from a cardiovascular standpoint, even potentially some association with colon cancer. And also remember, the number one thing that actually keeps people from getting to work from a medical standpoint is musculoskeletal problems. And sitting we're not designed to be sitting at desks all day long and hunched over keyboards and this type of thing. And so anything you can do to either get a standing desk or what have you, you certainly burn more calories by the hour when you're just standing alone, right? And so that's a huge thing. Even making sure you're getting good rest. I don't know if you've seen it at all or heard about it, but Tony Robbins came out with a new book called Life Force. And he was talking about I think he interviewed like 167 Nobel laureates and scientists and medical doctors and such. And he was actually talking about one of the things they talked about was with the with the time change, right? The daylight savings time, there's actually something like a 21% increase in cardiovascular problems following when we lose an hour of sleep in the fall, or no, sorry, in the spring forward, right? So
Yeah, right.
when we lose an hour of sleep, just losing 1 hour of sleep, there's 20-25% increase in cardiovascular events in people during the week afterwards. And one of the other things that they talked about that really struck me was that, I know you and I both believe in hormone optimization, testosterone, estrogen, progesterone, thyroid, what have you, but they actually showed that optimal sleep is 7 to 8 hours a night, right? You probably best served up between 10 p.m. and 6 a.m. But they actually showed some data that if you just spend 1 week and get 4 to 5 hours of sleep a night, you actually have hormone levels of somebody who's 10 years older than you. And so just that alone is a significant thing, right? But also, again, let's talk about, making sure you're drinking enough water, right? I mean, I talk about that all day long with my patients as a urologist, especially kidney stone patients. And again, we live in Florida here, but I mean, from North Carolina to California is what's known as the Stone Belt, because people don't drink enough water throughout the country in general, let alone we're in these places that are hot and humid and you sweat more and what have you. And so typically at least half your body weight in ounces of water a day, but you have to be careful where the sources are too, right? Because a lot of our drinking water is potentially contaminated. And so, whether you have a filtration device on your home unit or use some type of filter to kind of get out some of these heavy metals or what have you. And I would caution you just have to be careful, certainly with bottled water. I think Dasani and some of these other ones have classically been known to just be tap water from somewhere else in the country. So their bottled water isn't the best thing in the planet either, right? And so that's important. But, also, I mean, thinking about regeneration and that type of stuff, I mean, our body heals the best when we have, the best nutrients. And I think anybody who's not near the water and doesn't get, a fresh supply of seafood or fish in general, probably should be on an iodine supplement. And certainly, I think vitamin D has been kind of, touted for COVID, but it's a great supplement for our immune system. And I think, quite honestly, optimal levels of vitamin D, I think there's a lot of experts that actually argue that 60 to 80, or if you had a history of cancer, maybe 80 to 100 units would be actually better than what we typically classify. And I think in conventional thinking, 30 to 60 we thought was the sweet spot, but right. I think we're finding that the sweet spot is higher, and those optimized levels are a bit higher than that, and that's certainly important too, right? And so, making sure you're getting all that stuff done. I mean, certainly there's a lot of folks out there with GI problems. The microbiome of the gastrointestinal tract is very, very important, and supporting that with probiotics. And I think the other thing, what inflammation, I think, has been a big driver of a lot of problems, whether it's arthritis, whether it's GI problems, whether it's cardiovascular problems. One of the biggest things you can do to help yourself with that is try to stay away from the inflammatory compounds that are out there. And certainly trying to, take in lots of fruits and vegetables. Certainly, I'm not going to list them off for you, but there's the dirty dozen as far as fruits and vegetables to stay away from, as far as high volumes of pesticides like strawberries and some other things there. And there's the clean 15 that you can kind of pay attention to. You can look these up and try to work around these things. And if you have to, get organic. And even with your beef and what have you, and chicken and such, certainly staying away from the antibiotic loaded stuff, because that certainly all affects your microbiome of your gut and affects your health and your ability to absorb nutrients that way. Remember, we are at a cellular level. They're from a regenerative standpoint, regenerative medicine, they really focus on kind of cellular signals, right? And so a lot of the communication that happens in our body is electricity. It's electricity going down the nerve fibers to tell our fingers what to do and what have you. And a lot of our diet actually acidifies us. And remember, most of your batteries out there are alkaline, right? So you want to have more of an alkaline diet than you do an acid diet, which to some extent, coffee, alcohol, a lot of these things, even just kind of like white grains and whatnot, a lot of these things, sugars, they certainly acidify the body. But if you want to try to kind of counteract that or reverse it, you're talking about things like fruits and vegetables that they are great at alkalinizing the body. Even, like celery juice. A lot of people, there's a kind of a fad of folks using celery juice. Beyond that, though, like even just using, one of the common things we do for kidney stone patients, again, is to alkalinize the body to try to prevent acidified stones. And what we tell people to do is, 4 ounces of citrus juice every day. So whether it's lemon juice or lime juice, I usually say to stay away from grapefruit or orange because they have so much sugar in them.
Yeah.
But even just mixing them in your water and flavoring your water with lemon juice or lime juice, that can be great for your system to kind of alkalinize and try to recharge your energy. And so that's I think a huge thing. I think beyond that, though, one of the biggest things I've learned from Tony Robbins is just the mindset piece and the psychology of the world, right? And I think that psychology, he always talks about psychology is about 80% of business or success, right? The rest is, kind of the organic stuff, but the psychology is so important. And I think, unfortunately, right now in our world, there's so much negative news, negative whatever content you want out there that could be out there to consume is so negative. And that certainly, I think the CDC lists itself as, beyond the 4 most common comorbidities like heart pathology, lung pathology, diabetes, and obesity. I think anxiety and fear was one of the bigger drivers of potential COVID problems, right? And so, again, controlling. It's that old saying, garbage in, garbage out, right? So if you're putting garbage in here, it's gonna produce garbage in your body, and same goes with what you intake from a oral standpoint, from your mouth, from your water or your fluids or the food that you eat, right? And so that is, I think, something that people are starving for is truly kind of that to be able to take back their power from a psychology standpoint, which I think is so important.
Absolutely. And,
there's a lot more. There's a lot more.
For sure.
We could talk about it forever.
Yeah, for sure. And thank you for all that. That's, I knew when I first met you that you were a different kind of doctor. And, how many urologists know about gut health and just healthy body in general. And so I appreciate what you do. It's obvious that you care about your patients, and that's why you're doing something different, because you want to show that you want to educate and empower them, and you want to show them how they can, access good medical care without bankrupting themselves. That's very powerful. And I think, honestly, when you take an oath of medicine, when you take that Hippocratic oath, I think that's part of it. Really, if a doctor is bankrupting a patient by doing some procedure that they know is going to be $50,000 and the patient can't cover it, is that violating the Hippocratic oath? You could argue it possibly is, for sure.
Yeah, and I know him well, Keith Smith. He's commonly quoted as saying, how can you take an oath to do no harm and then allow a patient's life to be financially ruined, right? And I think that also goes to, I mentioned earlier in the show that, to some extent, my colleagues don't always necessarily understand the price. And I think that's so important. If you're going to prescribe something or recommend a surgery or what have you, understanding the price. Heck, I even had a patient who he only had Medicare A, right? So he didn't have outpatient coverage. All he had was inpatient coverage from Medicare A. He didn't have Medicare B. And so we were talking about doing an outpatient surgery, and the hospital wanted to charge him $20,000 for a cash price. And I looked at him and I was like, listen, I know for a fact that at an outpatient surgery center, I could do that surgery for less than $10,000. And so again, that just shows you, if you don't even know that information internally, right, or seek out that information as a clinician, then to some extent it makes it very difficult for you to kind of advocate for your patients in the truly grand scheme of things. Which, again, at the end of the day, the only value exchange in medicine is between a clinician and a healer, or a clinician and a patient. Sorry. And so from that standpoint, trying to really truly understand not only the best options out there, but also the financials of that, and what, how the patient can survive or kind of deal with that on their side, again, that goes back to having that relationship, having that time to understand, what your patient's financial feasibility is, and kind of trying to work with them to find the best solution that works for both. Because, it's kind of like the same thing as, for me, like, a lot of the stuff that we do is not urgent, outside of a few 5 things that are kind of true urologic emergencies. A lot of the stuff that we do is elective. And I always tell patients, I'm like, listen, I want to know from your cardiologist, and saying that we can stop these blood thinners, and saying that your heart is healthy enough to do this, especially even we talk about guys who are on 4 liters of oxygen and want to have a surgery because they have a catheter and they don't want to live with a catheter for the rest of their life, however long it is, which I understand. I wouldn't want it. So I understand that. But at the same rate, I always tell them, I'm like, listen, if I try to do a surgery to get you free of this catheter, but you end up dying on the table, that's not helping you very much. And it's the same thing. If I try to do a surgery and you're left with a $50,000 bill and going to collections and bankrupt, what? There's $500,000 or 500,000 bankruptcies in the United States that are majority due to medical bills a year. And I think,
and let's add to that most of those people have insurance.
I was just going to say 60+% have insurance, right?
Right.
So, that's crazy. Again, I describe it as the United Healthcare Syndrome, which is a spinoff of Stockholm Syndrome, where Stockholm Syndrome is this kind of syndrome where it's a psychology syndrome where, say, for instance, you're in a bank robbery and you kind of essentially, or you're held captive in some situation. You basically develop kind of a psychological bond with your captor, right? And so I think United Healthcare Syndrome for me is basically everybody thinks that a health insurance card is going to take care of everything for them, right? They think they can just, and I know you've done videos on this, comparing it to automotive industry and the hotel industry and et cetera, which I would encourage people to watch because they're amazing and hilarious. But it's so true. I mean, the Wall Street Journal article of March of I think 21 now, so 2 Marches ago, they talked about at the exact same hospital in California, you could get charged $6,000 or $60,000 for the exact same service. And so that'd be like going, depending on which insurance card you gave them, right? So that'd be like going to McDonald's, not knowing the price, all it says is market price up there. Or if you ask them, they won't even tell you what the price is.
Right.
And basically, depending on which credit card you laid down, your cost would be either $6 for your cheeseburger or $60 for your cheeseburger. And you don't know until 3 or 4 months later when they send you the bill.
Right.
I mean, it's crazy, right?
It is crazy. And we let it happen and it's legal. But you have outlined some ways to get out of that system. So that's what I appreciate. Instead of just complaining about the problem, you're doing something about it and educating consumers to be empowered to take charge of their own healthcare. So thank you so much, Dr. Wallen.
Absolutely. I mean, I think it's so important, and I know you do too. It's so important for lay people, patients, to become consumers again of medical care, and force these hospitals and systems to play into that, or finding other options and voting with their feet, so to speak, voting with their money, and going elsewhere, because there's certainly plenty of folks out there, again, as a physician, as a healer, I can actually decrease my cost of your visit basically by 30 or 40% just by accepting your cash payment.
Yeah.
And so from that standpoint, I can give you, a portion of that discount or a large majority of it, and make it, easy for both of us. Right. And so that's where the greatest value is, finding an independent healer and paying directly to them, without anybody else, without any middlemen like insurance companies, without, your pharmacy benefits managers that are jacking up prices of medicines all over the place. And that's the holy grail. But again, unfortunately, if people don't know about it, they can't take advantage of it. And that's where, I respect the heck out of what a lot of these folks in the Free Market Medical Association and what have you are doing across the country. But I just think that the movement will be so much more successful if patients meet us in the middle. And they truly understand how they can meet us in the middle, which is exactly what we try to do, is try to help them understand how they can do that, save money, and get the highest quality care across the country.
So it's obvious that you have a passion for this subject, just like you do as you practice urology on patients. So if patients have more questions, what is the best way to get a hold of you? I know you have a website that's in development, but tell us a little bit about that.
Yeah, so selfdirectedmedical.com is out there. It's we're redeveloping it. It's kind of generic right now, but it'll be redeveloped soon. Also, I mean, you can email me directly at jared@selfdirectedmedical.com. That's an email that I monitor directly, so you can always get in touch with me there. Also, Facebook, Twitter, Instagram, and YouTube. We all have channels for Self-Directed Medical on all of those as well. So those are easy ways to get in touch with us and follow along and interact. And we've run a couple of different beta testing as far as the best way to deliver the educational content. We have about a 6-week course that's ready to go if folks are interested in that, called Beat the Insurance Game. And we're also running kind of a free content, which is Healthcare 101, the cheat codes, right? So it dives a little bit deeper into some of the things that we talked about today as far as how you can go about, kind of beating the game, right? It's kind of like just like the old Sega Genesis, up, down, left, right, whatever, trying to get the cheat codes to truly kind of beat the game, because otherwise, again, the game is stacked against us. And I don't expect people to understand a lot of this stuff by themselves. I mean, I certainly don't, but I mean, if we can deliver them the cheat codes to kind of beat the system, that's where we can really take back all of our power. Because if we can get patients free of the system and clinicians free of the system working together directly, I mean, that's where the highest quality, lowest cost care will be found throughout the country, period.
Absolutely. Absolutely. Well, I appreciate your time and your knowledge today. It's always a pleasure speaking with you. I'm looking forward to talking some more clinical stuff in a few weeks on our podcast. And as always, Dr. Wallen, thank you so much. Thanks for fighting for your patients. I really appreciate it. I wish more doctors did the same thing. So thank you so much for being on. Thank you, listeners and viewers, for tuning in to Health Solutions with Shawn and Janet Needham. You can always find me on our Moses Lake Professional Pharmacy YouTube site. Please subscribe to our YouTube site so you don't miss any episodes. Also, we are streaming live on Twitter and on LinkedIn now, so don't miss us there. Follow me there and my personal Facebook page. So thank you for tuning in. Health Solutions with Shawn and Janet Needham. Thank you so much.